Welcome to this clinical walkthrough on the HIV follow-up case for UKMLA, brought to you by Mediate, your 24/7 practice partner.
Okay, let's be honest. This is one of the toughest, most emotionally charged consultations you're gonna face, both in the UKMLA and in your future career. The pressure is on. But what if you had a clear, simple framework to guide you through it? Well, that's exactly what we're gonna deconstruct today, so you can walk into that station feeling calm, prepared, and totally in control. So, let's dive in.
So, how are we going to tackle this? Our guide is a really powerful and easy-to-remember framework. CARE. That's clarify, assess, reassure, and educate. Think of it as your roadmap. It ensures you hit every crucial point, all while keeping the patient right at the center of the conversation. First things first, let's set the scene for the scenario you'll be facing.
All right, picture this. You're an FY2 in a GP clinic. The name on your screen is a 45-year-old man who has just been diagnosed with HIV. He's here for his first follow-up appointment with you. Your task is to manage this incredibly sensitive conversation, address his fears, and start planning the next steps. It's a big one. So, the first letter of our framework is C for clarify. And honestly, this is where you can win the consultation in the first minute. Before you jump into your own agenda, you have to find out what's on their mind. A simple open question like, I know you've just received this news. What's been going through your mind? Immediately puts them at ease and shows them this is their time. It's a game changer for building that instant rapport.
Okay, once you've listened to their initial concerns, we move on to A for assess. We're essentially looking at this from two different angles. First, we need to zoom in on the clinical history, what actually led up to this diagnosis. And then we need to zoom out and get a sense of the patient's whole life. For the diagnosis history, you're putting on your clinical detective hat. You're looking for any symptoms that might suggest a recent seroconversion illness, or more seriously, an opportunistic infection. So you'll be asking about things like fevers, drenching night sweats, any sudden weight loss. Each answer helps you piece together their current health status. Now for that zoomed-out view, the PMF-TOSA mnemonic is your best friend. It's a fantastic tool to make sure you don't miss anything crucial. And look, this isn't just about ticking boxes for the examiner. Understanding their social support, their job, their family plans, this is all absolutely vital for creating a management plan that actually works for them as a person.
And that brings us to the very heart of the consultation, R for reassure. After you've gathered your information, it's time to face the fear. Because behind all the clinical questions, there's usually one single terrifying thought running through their mind. Your ability to handle this moment with compassion and clarity is everything.
No. And then you immediately reframe their entire understanding of the illness. Comparing it to a manageable long-term condition like diabetes is so powerful. In one sentence, you've shifted the narrative from a death sentence to a manageable health journey. You're replacing terror with a tangible sense of hope.
Now, for a lot of people, the words HIV and AIDS are completely interchangeable in their minds, thanks to decades of old public health messaging. So you have to anticipate this question, and you need to be ready to tackle it directly. Answering this is a brilliant opportunity to empower your patient. You're explaining that AIDS isn't an inevitability, it's a preventable outcome. This reinforces just how amazing modern treatment is and shows them that they have a huge amount of control over their future health. Think about it. A diagnosis like this can make people feel like their entire future has been erased. And for many, the dream of having a family is a huge part of that future. So addressing this isn't just a side note, it's absolutely essential. Can you imagine the weight that lifts when you can look them in the eye and say, with confidence, yes? It's an incredible moment. You're not just providing medical information, you're handing them back a piece of their life that they thought was gone forever. Okay, here we go. This is probably the trickiest question you'll have to navigate. Partner notification. This is a delicate balancing act between your public health responsibilities and the patient's personal situation. Getting the tone and content right here is critical. The best approach here is a 1-2 punch. First, you need to be direct with your medical advice. We strongly advise that you do, but you have to immediately follow that with empathy and an offer of help. It's that combination of firm guidance and genuine support that makes all the difference. You're a partner, not a dictator.
Look, handling these sensitive questions with the right blend of confidence and compassion takes practice. It's one thing to know what to say, but it's another to say it well under pressure. If you want to really nail this down, you can practice this exact case right now, get objective feedback on mymediate.com.
So, once you've addressed their biggest fears, we move to the final letter, E for educate. This is where you empower the patient with knowledge and a clear plan. We break it down into 4 key areas:
the treatment itself, the practicalities of partner notification, some incredible news about sexual health, especially undetectable equals untransmittable, and finally, broader lifestyle and mental health support.
And you absolutely cannot end a consultation like this without a rock-solid plan. This means clear safety netting, what to do if they start to feel unwell or anxious, and a concrete follow-up. They should leave that room knowing exactly what happens next. The referral is being made, here are some resources, and I'll see you again in a few weeks. It sends a powerful message. You are not alone in this.
So you see, the CARE framework is your secret weapon. It takes what can feel like a chaotic, overwhelming consultation and gives you a logical, compassionate structure to follow. It allows you to stay in control, be thorough, and most importantly, be the supportive and effective doctor your patient needs in that moment.
Knowing the framework is step one, but making it feel natural and confident under exam pressure, that's the real skill. And the only way to get there is through practice. You can run through this exact case with all its challenges right now on Mediate.com.